In this clip, we're going to look at a whole series foam rolling the various parts of the leg. In these examples, doing the bottom of the leg and also the tops, you can do both sides in one go, as demonstrated here for the calves, or to apply more pressure, simply place one leg on top of the other. It's easiest if you only go roughly halfway, moving up and down the area, in this case the calf, and finding those particularly sore spots, those trigger points. When you find one, stay on it. Apply pressure for up to 30 seconds and feel that tension, some of that pain go away. When you've made the change, move on. Hunt around for any areas like that and make sure you turn so you get all the parts that you're working. Once you've done the bottom half, work up to the top half. You can also roll left and right without moving up and down. Find those spots. Find them, then work on them. Avoid bony areas, avoid crossing over bone. So you can work along the shin, that's fine. Varying the degree of pressure by keeping one foot on the ground, or adding more pressure by crossing the legs over. Again, working in all the sides. However, avoid crossing over joints, such as the knee. When you've done the calf, move up to the hamstring. Same principle, go roughly halfway, work the inside, work the outside. When you've done the area, and it will take longer than this demonstration, do the top half. Once you've worked the hamstring on one side, time to move on to the side. This spot, the iliotibial band or IT band, is often really sore. So start gently. You can use your back leg to take some of the weight off the roller if it's too intense. Same principle, roll up and down, just find those spots. And then always finish off an area just by doing a few rolls up and down, doing the whole of the IT band, and then moving on to the thigh. Again, you can have one knee down, take some of the weight off, or cross over and roll the top of the thigh, starting at the bottom, looking for those points, and moving up. I'll show you the inside of the thigh in another video because I prefer doing it on a bench, as shown here, rather than doing it on the ground, which can be quite awkward, I think less effective. As you roll in the thigh, what can also be quite useful is to find a spot, pin the tissue down, and then flex the leg. Release that, find another spot, pin the tissue down, and flex the leg. It's a little bit more active. Can get you some release around the knee area. So spend 5 or so minutes aside each day to begin with, and then when the knots are worked out, just roll back and forth, covering the whole leg. Once you're at that point, it will only take a couple of minutes per leg at the most, and you'll maintain that ease and comfort of movement. The same caveats as for other foam rolling apply. avoid any areas of injury, such as injury to the muscle, to the bone, to the skin, bruising, and be wary and seek advice if you're thinking of rolling any areas where you have a loss of sensation, for example, due to peripheral neuropathy. Otherwise, this is a great self-massage for the legs.